Hey guys, this is our fourth week in a row going live at noon on Tuesday. Um, so every single week we are going over a certain topic. So far we covered like pelvic floor 101. Week two we did, oh gosh, I can't even remember. And we did pregnancy. Um, did another thing, and then this week we are focusing on healing after a vaginal birth. So the reason why I wanted to go over this topic is because I hear just a lot of different questions that we get from new moms, either when they are pregnant or when they are postpartum coming to us. So I want to take a moment and actually go through some of these big things that we typically see in the clinic that we wish every new mom knew about healing after a vaginal birth. Um, so we'll just dive right into it. And this isn't super prepared. It's just all of the first thoughts that I've had when it comes to this topic. So the first one that I always hear is that people are so scared of the first poop, um, after a vaginal delivery. And it can be like very scary, especially after what your pelvic floor just went through. But some of like my top tips for that is like one, using a squatty potty. Um, and if you don't have a squatty potty to like bring with you to the hospital, they do have like these cute little travel ones. But honestly, you don't even have to get that fancy. If there's like a trash can you can turn on its side, um, sort of like this one, you can just take a trash can and put it on its side and use it to prop your feet on that. Or honestly anything that you have in the hospital room with you, you can prop your feet on, as long as it's a steady surface and you can put your weight through it, then that's fine. And you want to do that because it actually relaxes your pelvic floor muscles when you get into that deep squat position. A few other things to be mindful of with the first poop is usually they will prescribe like a stool softener, so just make sure to be using that as well. Okay, so that's the first poop. Oh, one more tip for that is making sure that you are exhaling or blow as you go when you're pooping, instead of like holding your breath and trying to like purple push that poop out. Don't do that. Okay, so let's say you get home and you know, you don't know what you can or can't really be doing. My rule of thumb is the first like week really taking it easy, and maybe the only exercises you're doing are like things laying in bed, like diaphragm breathing. Maybe you're doing some bridges to help get some lymphatic flow out of your pelvis. Maybe you're doing ankle pumps. Maybe you're doing some like easy, like I'm trying to think what else I love to do. Um, as simple as a straight leg raise, stuff like that. And really, you know, you don't want to, it's a balance between not exhausting your pelvic floor after it's already exhausted, but also moving. And so it is a balancing act. But honestly, by like 3 weeks postpartum, like you want to be like walking a little bit just so that you can get blood flow moving. And that's actually typically when we see patients postpartum is at the 3 week mark, just because you are literally not seeing anybody until 5 or 6 weeks postpartum, which is wild because your little one is getting checked in constantly. But as a mom who just delivered a baby, you aren't getting nearly the same amount of attention or care. Um, so that's why we typically see people at 3 weeks postpartum. A lot of times it's a virtual video visit where we walk through exercise that you should be doing, but also it can be in person too, where we actually will do some external work to help your body heal. So that when we get to the 6 week postpartum mark, once you've been assessed by your OBGYN and cleared, which by the way, cleared to do anything is not helpful. Um, so when they say clear to do anything, don't take that as an invitation to go on a 5-mile run. So that is my 2 cents when it comes to postpartum care in terms of pelvic PT and the 6-week checkup. Now, I did bring a pelvis model for today's video because I want to talk about some differences in the pelvis postpartum compared to somebody that hasn't had a baby yet. They actually did a study where they measured the distance of this bone, which is called your ASIS, compared to this bone, ASIS, on the other side. And they found that these landmarks were actually wider in postpartum women compared to women that have not had babies. Basically, that means your pelvis is like that. Now on the back side, what that looks like is your PSIS here, this guy and this guy, same thing, wider apart. So the fact that your pelvis has shifted, has moved, takes a toll on your body and can affect your healing too postpartum. Now, when it comes to the bony structures of your pelvis and healing postpartum, we typically will see some changes. So besides just this being wider, you'll also find that, so this is your sacrum here, and this is your tailbone. We'll find a lot of sacrum movement during birth is like that, which makes sense. So from the bottom point of view, here's your sacrum, here's your pubic bone. This bone just opens to allow baby to exit the birth canal. And sometimes that does not go back after delivery. And so one of our goals is to help guide the sacrum back into alignment. Another common pattern that you'll see is where the sacrum is, so here we use the sacrum, it'll be shifted. Let's see if I can do this. It'll be shifted up on one side. Sorry, my hand's blocking it. It'll be shifted up on one side, rotated, and open. And again, sometimes that doesn't always go back without a little extra encouragement from your therapist. The other pattern that you'll see often is where the sacrum just moves back. So here's normal position. If it were to move back, it would look like that way. And the last one that we see is where the sit bones, your ischial tuberosities here and here, they are more splayed apart out. So makes sense though, because for a baby to exit the birth canal, this has to open and get wider. So you can see it goes from here to here. That's the difference. And so part of our job is to help guide your pelvis back together from the bony landmark, like joint perspective. Now, when it comes to healing the muscle, you have to remember that your pelvic floor has just went through 9 months of overworking to hold your organs and your baby up. And so, and not to mention, who knows how long you were laboring for, those muscles were exhausted for that entire period of time. So postpartum, a lot of times we actually see the muscles are weakened and tense. And you're kind of like, Amy, that doesn't make sense. Why would they be tense when, everyone thinks that their pelvic floor is weak? And that's because when your muscles are overworked and tired, it becomes tense. And with your body working so hard through pregnancy, the muscles are just trying to find some sort of stability. And so a lot of times with postpartum moms, we're working a ton on this tension in their pelvic floor muscles and in their abdominals. And if you had a tear in the perineum, basically if you had a tear, usually people tear here, the perineal body. You can tear this way, this way, this way, anyway. Some people tear up towards the labia or up to the clitoris. And with the muscle tissue, we have to address the tension by doing some manual hands-on therapy as well as some exercises to help that for your pelvic floor healing. Especially if you have any scar tissue here, then we have to do some scar work on that too. Now the last step when it comes to recovering from a vaginal birth is once the tension is out and all your bones are in good alignment, then we can work on rebuilding the strength here. And not only here, but also the strength in your core, which would be here, and the strength in your glutes on the backside. So what happens when we don't work on these things and these healing patterns aren't followed? So that's where we'll see issues like postpartum leakage, maybe vaginal or rectal pressure or prolapse, diastasis where the abs separate. You might find back pain, pelvic pain, hip pain, pelvic girdle pain, pain with intercourse, abdominal pain, all those things. And it might be common and you might write it off as normal, but it's not normal. And there's a lot you can actually do to fix it. And I do want to point out that the higher pain that you experience in pregnancy can lead to more pain postpartum if you don't address it early on. And so our rule of thumb is getting people in during pregnancy to go ahead and be proactive and prevent the issues from even happening in the first place. And we'll also see like pain in pregnancy or postpartum. If it never is addressed, then usually in the second or third pregnancy, the issues come up a lot sooner and sometimes more severe too. So we did get one question that was submitted for this video. The question is, when should I start pelvic PT? And this was submitted by somebody who is already 18 weeks pregnant. And for that person, I would say now at 18 weeks is the perfect time to start, because if you wait too long, then you don't give your body enough time to train it and prepare it for labor. So we'll have some people that wait until like 30, 34 weeks, and it's almost not enough time to actually see a change. Because we know it takes your muscles about 6 to 8 weeks to even change physiologically. And then I'm going to apply this question to postpartum. So when should I start to see a pelvic PT postpartum? And the answer is, if you want the gold standard answer, that would be at the 2 to 3 week mark postpartum. If you want the more common answer, some people will say 6 weeks, but honestly, so much happens between 0 to 6 weeks that sometimes waiting until 6 weeks is too long, and a lot of things change and get weaker by that point. So, yeah. And then if you are way past 6 weeks and you're noticing issues, then you want to get in ASAP. So, that is postpartum healing of the postpartum pelvis and pelvic floor. If you have any other additional questions after this video, please submit them in the comments below. And thank you guys for watching. We'll be back next week, and I'll post the topic on Friday.